Hi, good afternoon. I am Avil, one of the registered nurses working in this accident and emergency department. Please have a seat.
Yeah, thank you.
Could you please tell me your name?
Yeah, my name is Vibina.
Okay, Vibina, how may I assist you today?
I got injured in my forehead, burn injury.
Okay.
It happened, so I am little bit worried about the scar. So
Your introduction is amazing. I'm quite happy with that. So you are able to politely showcase your skills to ask the questions towards the patient.
Nice.
can you give me some information and treatment for it?
Yeah, don't worry. I'll give you some information about that. So could you please tell me more about your injury? How it happened, when it happened?
Yeah, it happened before few minutes.
Great way of asking the questions. Okay, you were able to ask the relevant questions to get more information about the incident. So I'm quite happy with the way that you have been asking the questions.
I am happy.
Okay.
While I was doing hair curling, I was watching the TV too. So without
Okay.
knowing, I injured myself.
Okay.
As soon as I got injured, I just applied towel, cold towel.
Okay.
So yeah, that's what I did. Then I came here.
Okay. Yeah, don't worry. I'll I'll give you some possible treatment from our side. So first of all,
Okay.
I'll give you analgesics injection. Secondly, I'll give you ointment. It will prevent infection. So thirdly, I'll cover with gauze. Finally, I'll give you painkillers to take it home to reduce your pain. Are you happy with that?
That's amazing. So the way you are connecting the sentences is amazing. So you were connecting the sentences one by one using the linking phrases. They will definitely help you out a lot.
I am fine with that. But
Okay.
could it, whether it will affect my career, because I think the scars will remain forever in my head, right?
Yeah, I can understand your situation. So it will not appear for a long time. It has some treatment. It will disappear. So don't worry about
Okay.
that.
Okay. Can you give me some information regarding this burn injury and scars?
Yeah, I can explain you detailedly. So there are many ways to recover or
I can explain you detailedly. Okay, all right. I can explain you detailedly. There is no word like detailedly. So you have to use I can explain to you in detail. All right, this is more appropriate.
I understand. Thank you.
so first of all, you have to keep moisturized your wound area. So you have to cover whenever you go outside. You can use sunscreen also. So
Okay.
next you can use aloe vera gel to protect your skin. So finally, you can have a healthy diet and enough fluids in your body. So are you happy with that?
Yeah, I'm happy, but can you say how long it will take for the burn to heal?
Okay, yeah, I'm glad to explain you regarding this. So it will take around 3 to 6 weeks to heal, but don't worry, it will disappear. The scar will disappear.
It will disappear and then the scar will disappear. Okay, you don't need to tell the same thing twice, isn't it? You can use only once. Okay, you can say, for example, the scar will disappear. That's okay, or it will disappear. So use once only. You don't need to tell the same thing twice, isn't it?
Yeah.
Do you have
But
any concern?
yeah, but this is actually a long time, long duration, right?
Yes.
And the wound will heal within these days, but the scar will remain a few more days, right?
Yes. Yes. Don't
Okay.
worry. Yeah, I can understand your situation. So The scar may take some.
Okay, so you said I can understand, or don't worry. So those kinds of words don't need to be repeated again and again, isn't it? Don't worry, you are repeating this phrase several times. Instead, you can use other phrases. Instead, you can use other phrases such as you don't need to be overly concerned. You don't need to be overly concerned. Or you can say, there's nothing to be alarmed. There is nothing to be alarmed. Okay. And so on. So there's a lot of phrases in that you can use. Instead of saying I can understand your situation, you can repeat, you can use different phrases, right? So do use different phrases instead of repeating this phrase. So you can say, for example, instead of saying I can understand where you come from, I can certainly understand your anxiety.
Some days. So what I'm going to do is you have to prevent your wound first. So if the scar develops, means please don't pull that. So after the wound heal, we are having cosmetic treatments to disappear the scar. So don't worry about that.
Yeah, that's fine. Then I'll.
Yes, your explanation is great. I'm quite happy with the way that you are explaining the information. So your explanation is good. I'm quite happy with that.
I'll wait a few more days till my wound get healed.
Yeah, moreover, we are having dermatologist. I'll offer with him, so he will help you.
Yeah, that's fine.
I will offer an appointment with him. Okay, that's what you got to say. So you said I will offer with him, isn't it? I will offer with him. This is wrong. You should say I will offer an appointment. I will arrange an appointment with him. I will arrange an appointment with him, and he will help you. Okay.
Okay. Do you have any other concerns?
I think no.
Okay. Please remember, you have to come back for follow-up visit in 2 weeks.
Okay.
For follow-up visit in 2 weeks? No, for a follow-up visit. You should say for follow-up visit in 2 weeks. That should be for a follow-up visit in 2 weeks. Okay. So you need to use the articles appropriately. So that should be for a follow-up visit. Okay. So for a follow-up visit. All right. Let's continue.
Okay, I'll be coming.
Okay. Is there anything else that you'd like to ask?
No.
Okay. To summarize what we have discussed today, I explained you regarding the burns and the scars and how to manage that one and what to do in your home. So I informed you regarding the follow-up visit also. So do you have any other concern?
I think no. Thank you for your information.
Okay, thank you. See you in 2 weeks.
That's amazing. So I'm quite happy with the way that you are doing in this role play conversation. So it has been absolutely fine. Except these small mistakes, your role play conversation was really great. And I'm pretty confident that this role play should be able to get you at least 350 out of 500. Well done, Abil. You have done a wonderful job. Thank you.
So glad you finally made it!